Welcome to Floyd Valley Healthcare Joint Cap. At Floyd Valley Healthcare, we're focused on keeping all the care you need convenient, accessible, local, and you moving. In this video, our staff will review your shoulder procedure, how to prepare, and what you can expect when you head home after being discharged. Making the decision to have a joint replacement is a big one. Our joint camp will review your procedure and help you take advantage of all the post-op care and services available at Floyd Valley that can make your surgery a success. Let's get started.
Here's what you'll need to know before your surgery. Now, no matter how independent you are, you'll need assistance. This means you'll need to plan for help at home. You'll need to consider equipment needed at home, meal prep or assistance, and help at home, such as family members or home health.
If you have any of these items available, they can support your recovery at home, such as a toilet riser, grab bars in the shower, or grab bars near the toilet for transfer on and off, or a shower chair or bench for bathing, slip-on shoes, and a looser shirt or button-up shirt.
Please prepare your home by setting your bed up to get in and out away from the surgical arm. You may find that you are most comfortable sleeping upright in a recliner. Move frequently used items that are on a lower shelf to counter height to make it easier for you to complete daily tasks.
Cooking may also be a challenge after your procedure. If you have concerns about meals, please let us know the day you have surgery and we can help you with this. And again, don't forget to discuss help at home. Don't go it alone. Having the proper assistance and following your treatment plan will support a successful recovery.
Let's discuss recommended preoperative exercises. Your team will provide a handout detailing the preoperative exercise recommendations. These exercises create a motor memory in the muscles, which will help you with your recovery after surgery. The first exercise is an ankle pump. Ankle pumps help prevent blood clots and reduce swelling when you are not moving around as much. Sit down in a chair or lie down on a bed. Flex your toes so that they are pointing up towards your head. Hold this position for 3 seconds. Point your toes forward as if pushing down on a car gas pedal. Hold this position for 3 seconds. The next exercise, the shoulder blade squeezes, creates stability for your shoulder complex and improves posture. For these, raise your arms to shoulder height, elbows bent, and palms forward. Move your arms back, squeezing your shoulder blades together. Hold for 10 seconds. Wrist range of motion exercises aid in prevention of muscle loss and maintain blood flow post-operatively. For these, move your hand up by bending your wrist while closing your fingers into a fist. Hold this position for 5 seconds. Release your fingers and bend your wrist back down. Hold for another 5 seconds.
We'll need a complete list of the prescription medications, over-the-counter medications, vitamins, and supplements that you currently take. The pre-op nurse will call to discuss which medications must be stopped and which are clear to take the day of. Any routine medications needed during your stay will be provided by Floyd Valley Healthcare, as well as any needed for pain, blood clot prevention, or infection prevention.
The night before surgery, we're gonna have you shower up real good using an antibacterial soap. Any antibacterial soap, just as long as it says antibacterial soap. Scrub that extremity up real well. Don't put any lotions, creams, or powders on after you shower up. Nothing to eat or drink after midnight, the night prior to surgery. You can continue to drink clear liquids up until 4 hours prior if you're diabetic, and 3 hours if you're non-diabetic. We do recommend that you drink a 12-ounce Gatorade of your choice as your last drink. It just gives your body electrolytes and some good carbs to kind of get you through that surgery. The morning of surgery, we'll have you shower again using that same antibacterial soap. Again, no lotions, creams, or powders after you shower. Make sure that you don't have any nail polish on. Remove all the jewelry, leave all your valuables at home. Wearing a button-up shirt or a loose-fitting t-shirt is recommended because it makes it a lot easier to get dressed after surgery, and it's more comfortable when wearing your sling. So just remember to bring that button-up shirt or your oversized t-shirt in your overnight bag the day you have your total shoulder replacement. Check-in time is going to be 2 hours prior to surgery. You'll check in here at Floyd Valley using the west entrance of the hospital. When you check in, you're going to need your photo ID, your insurance information, your overnight bag, loose-fitting clothing. Make sure you got some good shoes with some non-skid treads so that way you're not slipping or tripping in the hallways as well. If you use a CPAP machine at home, make sure you bring that with you because you will be spending at least one overnight. If you have any dentures, hearing aids, glasses, make sure you bring the cases if you have them so that way we can protect them when you go to surgery. After you check in downstairs, the admitting area will bring you up to the surgery department where you will meet with myself or some other team members. And you can expect to be in the pre-op area for about 2 hours prior to your surgery. And in the pre-op area, we are going to get everything finalized into the computer, make sure we check your last doses of medications, start your IV, give you the proper fluids and medications that you need. You will meet with anesthesia that morning along with your surgeon. So if there's any questions at all, don't hesitate to ask us.
I'm talking to you today about your anesthetic and postoperative pain management care for total shoulder arthroplasty. When you come the day of your surgery, the preoperative nurse is going to get you ready for surgery by giving you oral medications that will help with your pain postoperatively. Those medications are non-narcotic and they help by decreasing pain by diminishing the inflammatory response that occurs after a surgical incision. Once she's gotten you all ready for surgery, we're gonna go ahead and get you ready to have your anesthesia performed. In the case of a total shoulder arthroplasty, we do have to put you completely to sleep, and that does mean that you have to get a breathing tube placed. But that breathing tube is going to be placed after you're completely asleep, and it will come out before you're totally awake, so you're not going to remember it being there. What you may notice when you wake up, however, is that you have a sore throat. That sore throat typically lasts less than 24 hours. Staying well hydrated after your surgery and drinking plenty of water will help it go away faster. We're going to put you to sleep using the IV that the nurse has inserted. We'll give you some oxygen to breathe as you're going off to sleep, and of course we'll monitor your vital signs through the whole procedure. Before we take you back to the OR, however, we'd like to do a postoperative pain block. We use ultrasound guidance to locate those nerves, and then we inject a local anesthetic around them. That medication sits there for 3 or 4 days to help decrease the amount of pain you're going to experience. That also allows us to decrease the amount of narcotic medications that you're exposed to as a patient. Narcotics come with their own set of problems, including a risk of dependency. So if we can decrease your exposure to those medications, it's going to benefit you as a patient. We're still going to give you non-narcotic pain medications and have those other opioid or narcotic medications available as you need them after surgery. But in most cases, the nerve block is an excellent way for us to provide you with good quality analgesia or pain control after your surgery. As far as the anesthetic goes, we will give you medications to help decrease your risk of nausea, as that's a known complication of a general anesthetic. But because we don't have to give you opioids during the surgery because the nerve block is working well, your risk of having postoperative nausea and vomiting is quite low in this facility. We look forward to having you with us.
For your shoulder replacement surgery, I'll see you in the anesthesia holding area where I'll mark your shoulder and we'll have you go back to the operating room. The surgical approach is in the front of the shoulder. We do have to make a small incision in one of the tendons of the shoulder that we do repair after the surgery. We resurface your shoulder joint, and once we get a nice new shoulder in and everything looks good, we close everything back up, and then you'll be taken to the floor where you'll spend the rest of the hospital stay and start your rehab and recovery.
After your procedure, you'll likely have some prescriptions sent to your pharmacy. Your medical team will review these with you prior to discharge. They could include pain management medications, antibiotics, blood thinners, or anti-inflammatories. You'll also have some more options for comfort, like ice or elevation, that your doctor or therapist will cover with you.
Congratulations on your new shoulder. It's time to begin your transition home.
Most shoulder replacement patients return home the day after surgery. Generally, physical therapy will see you to go over a home exercise program and make sure that you can safely function after surgery. You will need to have someone available to drive you home the day after surgery. You need to wear the shoulder sling at all times after surgery, except when dressing, bathing, or engaging in your home exercise program. You can loosen the sling when resting in a seated position. Make sure to prop it up with a pillow. Avoid pushing up from chairs with your surgical arm. You should not reach with your surgical arm, especially behind your back. Outpatient physical therapy typically begins after your 2-week follow-up with your surgeon.
Shoulder surgery takes time to recover. I do like to keep you in a sling for a period of 4 to 6 weeks after surgery. Your shoulder will get stiff, and that's why physical therapy is a big part of this recovery. I usually tell people, give the shoulder surgery a good 4 to 6 weeks before you start to really see the range of motion improving. And it's going to take a little more time for strength to follow that, but the pain relief is usually very reliable. I see people back at 2 weeks, and usually they're doing quite well, so you should expect pain relief quickly, still having some shoulder stiffness, and strength will improve with time.
Activities of daily living may be challenging after your shoulder replacement, but Floyd Valley Therapies can help make sure your transition home is a smooth one. After your surgery, keep in mind these recommendations and precautions. Refrain from any active shoulder movement until your physician approves them. Button-down shirts will be easiest to wear. Oversized shirts are also an option. Wear your sling or immobilizer until your physician recommends otherwise. Make sure your sling and arm are positioned so the arm is laying across the stomach and elbow is pointing out to the side and not back against the body. When sitting, place the pillow behind your elbow to ensure it does not fall back. Lastly, wearing slip-on shoes may be easier initially. Make sure they have enough support and a good tread. Getting dressed may be tricky for a time after your surgery, but Floyd Valley Therapy's occupational therapists have some great tips. Dress your surgical arm first by placing your shirt face down on your lap with the collar at your knees. Gather the hole of the surgical sleeve, lean forward and place your surgical arm into the sleeve hole. Pull the sleeve up to your elbow and then place the non-surgical arm into the sleeve. Grasp the shirt and pull over your head. Adjust the shirt with your non-surgical arm. Occupational therapy will also discuss your home and bathroom setup during our evaluation following your surgery to determine any individualized additional needs.
Once you're home, if you have issues or questions about your shoulder replacement, the staff at Floyd Valley Healthcare is a phone call away. And thank you for choosing Floyd Valley Healthcare for your total joint replacement.